Hello everyone, welcome back to the Eat, Burn, Sleep podcast. Today we're going to talk about the microbiome, about dentistry, about the importance of your health in your mouth with your gut health and overall health. My guest is Dr. Victoria Sampson, who's a gorgeous young 29-year-old Persian English girl who lives in London. We met through Instagram and I was invited to her dental practice. I was quite impressed by her work. So, of course, I wanted her here as a guest of the Eat, Burn, Sleep podcast. Victoria, how are you?
Thank you so much for having me. I'm great. It's a pleasure to be here. I've always been a huge fan of your work, and when we opened the clinic, a friend of mine was like, you should try and message Yalda and see if she'll come to your clinic. And like, you guys seem quite similar. And I was like, she'll never respond. And then you did. And then you came and I was like, fantastic. And here we are.
I respond to all the messages on Instagram. People say to me, how do you do it? I take the time. I allocate like an hour a day. I care about that connection. Because for work, to be able to do better, you see patients every day in your clinic.
Yeah.
I don't. My work is online. So if I don't keep this connection with people opening up to me, telling me about their problems, what they're going through, I don't get inspiration to research.
Mm-hmm. Yeah, that's true.
So I do respond to all my Instagram messages myself. So Victoria, you're a functional dentist and researcher based in London. You obtained your bachelor in dentist surgery from Barts and the London, and you are known for your work in developing salivary diagnostics, microbiome testing, and incorporating AI into everyday care. Your work has been acknowledged worldwide, resulting in you becoming a scientific advisor, board member, and clinical lead of multiple dental companies globally. Pretty amazing. You've published numerous papers in the UK and internationally, and you were the first dentist in the world to link gum disease with worse COVID complications. You're the first dentist to be shortlisted for Forbes 30 Under 30 in healthcare and science in Europe, and you have now founded your own multidisciplinary health center in London, aimed at putting the mouth back into the body and connecting the oral microbiome with general health. You're also a topical member of the European Space Agency and NASA, aimed at creating guidelines for astronauts before long-haul flights.
Yes.
Pretty extraordinary.
Thank you. Yeah, dentistry's kind of taken over my life. So.
I love that. You've taken a topic and you have gone so far with it.
Yeah.
So how do you go from studying to be a dentist to effectively going into functional health and using this angle? So a lot of people don't realize that the mouth is the start of the gastrointestinal tract and separate it when the GIT goes from the mouth all the way to the rectum. When did you pivot from, fixing teeth and just looking at a pretty smile to actually wanting to work on the structure of the microbiome in the mouth and improving people's overall health?
So I think there's a few different reasons for it. The first was I had some family who were very sick, and I started to see how their mouth was being impacted by their general sicknesses. Family who were going through chemotherapy and their mouth was really dry. They weren't able to brush their teeth, all of these things. And I was realizing that what I was doing in the dental chair was actually quite important. And it wasn't just drilling and filling and taking teeth out, but actually helping these patients. And then COVID happened. As a dentist, we weren't able to work for a couple of months. And anyone who knows me will know that I can't really sit still for longer than like 2 hours. This is probably the longest I'll sit for this podcast. So I decided to do some research, and I had an idea that COVID was connected to gum disease because all of the risk factors which were associated with worse complications of COVID are also the same risk factors which are associated with gum disease. So I wrote a paper on it. It was the first one to really bring dentistry into the picture. And what it did was then it allowed me to do research in universities and in hospitals. And so we started trials in a few different hospitals. And we were essentially trying to see whether or not patients who were suffering from worse COVID complications had bad oral health. But the problem was that we weren't able to visit these patients because of COVID. So the only way that we could actually see what was going on in their mouth was through their saliva. So we were collecting their saliva, we were doing swabs, and then we were actually getting a snapshot of that patient just through their saliva. And we could see what bacteria they had, inflammatory markers that they had, and understand what type of patient that was. And we were able to predict how bad their COVID complications would be based on what their oral microbiome was like and what their mouth was like. And that just opened my eyes to the fact that saliva is a lot more than what we think. And I was thinking, well, if a doctor, you go to the doctor and you get a blood test, why don't you go to the dentist and get a saliva test? And there's so much that we can see through saliva, and it's a very underused kind of diagnostic medium. And then that led me to creating microbiome testing and trying to make it more of a commercially available thing. And then when you start looking into the microbiome, you then realize, like you said, that nothing is completely isolated and everything's connected. And if I'm working on the oral microbiome and your gut's a mess, I'm never going to be able to balance it, and vice versa. Or if you have inflammation because you have arthritis, that's going to impact the inflammation in your mouth. And that really started my journey.
So interesting. And it's very true. During COVID, at the beginning, they were saying, oh, people with underlying symptoms have more complications and higher chances of dying. But really, the other health issues were linked to immune system dysfunction, so chronic inflammation, stemming from poor gut health. And of course, that would show in the saliva, and poor mouth health. And all these things are linked to gum disease indeed. It's fascinating how every step of the way with our job, your job, my job, we are reminded every day that all the systems are connected. The nervous system, the gastrointestinal system, the musculoskeletal system, it's all connected. Actually, recently, I actually posted about it on Instagram. 10 days ago, I went to Chinatown with my children. We went to the theatre in London. My boys are massive foodies. They love street food. They love Asian food. We were in Thailand this summer. They're like, Mom, let's go to Chinatown and do like a little tour of all the little restaurants. So we went. And I know that a lot of these foods have additives I cannot tolerate. But I wanted to be carefree and 15 again. So I was eating with them. And then they went to a supermarket and they bought some things. On the way back home, I fancied something sweet after all this junk, you then want sugar. And I asked my son JJ, what sweets did you get from the Asian supermarket? And he said to me, you're not touching my pandan cake. That's my cancer.
Oh my God. Wow, you've taught them well from an early age.
So I was laughing out loud, came home, still had a slice of the cake. Silly me. And then I can't tell you the gut disruption I've been through afterwards. And what happened is something that I've spoken about on Instagram, but that I hadn't fully experienced myself. 2 days later, so I'm back on my IBS protocol. I'm thinking I've got to be good again. I've had no more of this like self-destruction, because really it's self-harm. I know it's going to hurt me. Why am I doing it? And I go on my mat to do some yoga. I was like a 90-year-old who hadn't moved in 30 years. My body was so incredibly stiff. And 2 days later, it was better. That was a reminder to me of the link between the gut microbiome and the joints, which I had forgotten about. And when you're an IBD sufferer, inflammatory bowel disease sufferer, and you go to the doctor, one of the things they ask you is, do you have any joint pain? And because I have been in remission for so long, I've forgotten about it. Anyway, all of this to say that indeed all the systems are connected, and the work you're doing is amazing. I came to your practice, and as I was saying to you, because my symptoms are under control, I haven't been so strict over the past year or so, hence the episode in Chinatown. But you did a saliva test, and one of the bacteria showed that in my result was not good. That was a great reminder to me that sometimes you may be asymptomatic, but it doesn't mean you don't have inflammation. So since 10 days ago, I'm firmly back on my protocol. So thanks to you, Victoria.
Thank you. I'm glad that I helped. Yeah, I was looking and I was like, ooh, maybe I don't know if this should be there or not, but you're right. And a lot of So I have one of the other kind of things that changed my career was actually rheumatoid arthritis. So speaking of joints and inflammation, and I had a patient who was sent to me by a doctor, and she had been suffering from really bad rheumatoid arthritis. She had Baker's cysts. She couldn't walk properly. She was really very unwell and very depressed as a result. And she'd seen numerous doctors. She'd seen numerous functional practitioners, nutritionists, everyone. And no one really could tell her what to do. They put her on a Mediterranean diet. They said, don't eat sugar, and then they put her on loads of dexamethasone, loads of steroids. And then one of the doctors was like, have you gone to the dentist in the past year? She was like, well, yeah, every time I go to the dentist, they just take 1 or 2 teeth out. And in the past year or so, since I've been diagnosed, I've had 6, 7 teeth taken out because I have such bad gum disease. And unfortunately, the dentist did not actually think, well, maybe, this patient has gum disease, I should treat it. They were just kind of resolving the pain and the problem. So she was sent to me. I did microbiome testing. We did, we even did genetic testing. We did inflammatory marker testing, everything on her. And we treated her gum disease. We changed her microbiome. We did everything. And in combination with the work that the doctor was doing at the same time, within 6 months, she was off her steroids. She was not on dexamethasone anymore. She was walking happily and was like a different person. And sometimes I think we fail, like in our jobs, we fail to sometimes appreciate the impact that we can have, not even on the thing that we're meant to be good at. Like as a dentist, I should be good at sorting out your mouth, right? But actually my impact can be on your knee. Or for you think you're impacting their gut, but actually you're helping them with their brain fog, or, it's all connected. And that was for me one of the biggest turning points where I was like, wow, this is serious. This is real,
It's so funny you say this because I had quite a few testimonials about people who didn't have inflamed gums anymore, who were on the lifestyle. Because it's all linked. Arthritis, gum health. And as I was saying to you before we started the podcast, I kind of fell off the wagon. I was at 60-40 rather than 80-20 with my method for a while because my symptoms are better, so there's no threat of hospital stay or surgery or taking steroids or immunosuppressants like in the past. And also because I got COVID mildly, not last Christmas, the one before in December. And there was only one day where I didn't feel good. But after that, I had massive cravings because of the impact of COVID on the gut. And since then, I have been, not as strict with my protocol. And what I know, and that's why I'm back on it now for a while, is you don't change the structure of your gut in 2 weeks. That's why I have this 6-week reset. It has to be through time and consistency. And then it changes. A lot of people say, it changes your taste buds. I don't crave these things anymore. It's because you've improved your gut flora and you don't have cravings for the wrong things. But yes, everything is absolutely linked. So, the connection between oral and gut microbiome. For example, for people with colitis, what is the oral presentation? People with Crohn's, IBS. So what do you see from your standpoint in your practice when people with these different diseases come to you?
So interestingly, we often can actually see symptoms or a clinical presentation of ulcerative colitis or Crohn's before the patient actually starts to feel symptoms in their gut. And the reason why is because the oral mucosa turns over much faster than the gut mucosa does. So that means that we see things in the mouth before you can feel or see things in the gut. So in terms of what we see, it's often ulceration, similar to, ulcerative colitis, but in the mouth. So patients who just have unexplained ulceration. Also for Crohn's specifically, and mainly in children, they get very inflamed lips. So it's called orofacial granulomatosis. And it basically is like a granuloma in the lip. It's a very, very inflamed lip to the point where they can't close their mouth anymore. They get something called cobblestone mucosa, which basically it looks like a cobblestone. So the inside of their cheeks become really rough and they look like a pavement or a cobblestone. And then we also see, because of irritable bowel symptoms, the patients will often not be eating properly, and then starts the nutritional deficiencies. And then we see things on their tongue. So their tongue can become quite red and beefy, very swollen looking, and that's indicative of a vitamin B deficiency. Iron, it makes the mouth look a little bit pale, like the gums and the tongue feel pale, and again, ulceration too. Vitamin C is you get really bad bleeding gums because vitamin C is part of the clotting factors, or it helps with the clotting cascade as well. I actually probably see this on a weekly basis. Like some sort of patient I will send for bloods, or I'll be like, I think you might have some sort of deficiency, or it's not normal to have so many ulcers constantly like this. Maybe we should get you tested for, other things as well.
Amazing. That's wonderful. I had no idea about this. I mean, I knew about, the look of the tongue and the pale because in naturopathy, we check people's eyes and tongue, but I hadn't realized that you could really pinpoint signs like this of particular disease. You've mentioned a link between heart disease, Alzheimer's, and mouth health. For things like Alzheimer's, it's been shown that it's not only genetics, that genetics actually play a small part, but unfortunately it really is on the rise. Yes, it is linked to chronic inflammation. We know that, but how can someone come to you and work on prevention of diseases like this that you get when you're older?
Most general diseases, so basically bar Alzheimer's, we'll get onto that in a second, but in terms of things like diabetes, heart disease, even things like infertility, the main kind of connection with the mouth and these diseases is something called low-grade chronic inflammation. So it's the idea that a patient can be walking around with gum disease, not really realizing or not really addressing it. But what it does do is it's a constant firing of inflammation from the mouth elsewhere to the rest of the body. And that can slow down your body's immune system. It can add petrol to the fire. So if you have another inflammatory condition and then you've got all this inflammation being fired from your mouth to the rest of your body, it just makes things worse. So that's where the main connection with a lot of the other diseases are. But in terms of Alzheimer's specifically, it's a really exciting area of research at the moment, because what research has found is that there's a specific oral bacteria called Porphyromonas gingivalis, and it releases a specific enzyme called a gingipane. And these gingipanes are able to travel up to the brain. And if you think of how close your mouth is to the brain, it's pretty close. I think it's 20 centimeters or 17 centimeters. These gingipanes can travel up to the brain and actually cause disruption in the brain. And what they found was that in 70% of patients who suffered from Alzheimer's, they had very high levels of gingipanes in their cerebrospinal fluid and essentially in their brain, compared to patients who did not suffer from Alzheimer's, who had no levels of gingipanes. They shouldn't be there. And these gingipanes are toxic enzymes, so they help to break down kind of dark or grey matter. They help to essentially deteriorate the brain. So what we're looking at the moment at our clinic is we are testing for Porphyromonas gingivalis. So we're looking for that specific bacteria which creates that specific enzyme. And we are essentially trying to get rid of that bacteria. And like you said, genetics play a role, but actually a lot smaller of a role than we thought. And fine, you might have a genetic predisposition to something, but unfortunately that's not something you can change. But what you can change is what bacteria you have in your mouth, or the lifestyle that you lead, or the inflammation that you have. So this is one of those things. And to get rid of Porphyromonas gingivalis is not as difficult as people think. It's like using natural forms of honey, like different types of things like that. And I try and keep things very, very natural. But yeah, that's an area that we're really focusing on at the moment, because it's, like you said, it's a rising issue, and I think it's just going to get worse, to be honest with you.
That's fascinating. How often would you recommend for people to have their saliva tested? It's time for a little break. Hey everyone, I hope you're enjoying today's podcast. A reminder to all our listeners to subscribe, rate, and share this podcast with your friends and anyone who might enjoy listening to it. We also have a discount code for all our podcast listeners, which I will be sharing at the end. Keep listening, and I hope you enjoy the rest of this episode. How often would you recommend for people to have their saliva tested?
So I would definitely, I mean, I think everyone should have it done at least once. If you want to be an A-star student, I would do once a year to once every 2 years. And that's just to maintain, because what we do is we test your saliva for bacteria and inflammatory markers, all of that. But your mouth is constantly changing, and it's always, it's the entry point for a lot of things. So we see that people's microbiomes change when they've had COVID, even when they change partners, when they change their habits, all of these things. And so it's very easy to change the microbiome from my side. I can alter it quite easily, but it's also something that you need to maintain and keep checked once in a while. So yeah.
As a lot of my followers know, I'm not someone who recommends tests easily, because there's a lot of marketing out there. There's a lot of stuff that doesn't need doing. For example, intolerance tests. Often, to me, they're not very helpful. It's just a sign of leaky gut. And if you fix your microbiome, you'll realize that a lot of foods that showed up in your bloods will not. And, sometimes you'll do an intolerance test today and then you do another one next week. And depending on what you've eaten and how you've slept, the results will be completely different. But that's on the one hand. On the other hand, I'm also someone who thinks that health is our most precious asset that needs to be looked after and invested in. I'm definitely coming back to do a follow-up saliva test.
Well, I think it's really nice for people to take control of their health. I completely agree with you in terms of like over testing. I think people get kind of exhausted by if you test too much, and also it can start issues with patients getting a bit too obsessive over, very small things like a bacteria or, but on the other side, like you said, we're now in an era where patients have a lot more knowledge at their fingertips. They want to understand what's going on in their mouth, their gut. Most people are wearing a wearable. I'm wearing a Whoop. Other people wearing Oura rings. They're tracking their health data. And part of that for dentistry, in my opinion, is salivary diagnostics, is microbiome testing, because that's something that a patient can understand. Whereas if I sit there and I tell you you've got, bleeding on probing and a probing depth of 6 millimeters on your lower left 7, like, you don't know what that means. But if I say you have high levels of bad bacteria, you understand that you can track it and monitor it and get those bad bacteria back to a healthy place.
Absolutely. As far as I'm concerned, I very much care, but these are my own goals. I want to age with wonderful cognitive functions and physical abilities. What inspired me was to see my parents. So I have two completely extreme parents. My mother, who used to be extremely sporty when she was young, beautiful woman, very charismatic, who has not taken care of her health. And on the other hand, my dad, who has consistently exercised, eats healthy, sleeps well, and he's, touch wood, 79 years old. Yes, he looks early 60s max, but forget about the way he looks. His brain is fresh. His body is functioning. When I go to Morocco, he'll come and he doesn't allow me to carry the suitcases.
Oh.
But that's wonderful. I want to age like that. My dad is 6 years older than my mom, but I've seen such a difference. And it takes discipline. People say to him, oh, you're so lucky, genetically, you're so blessed. It's not. I've seen him my entire life. He was cycling, playing tennis, jogging, and now he's almost 80. He's walking every day, doing Pilates, stretches, and he sends me pictures of his food, and he goes, Yalda, do you think I should be squeezing some lemon on my lentils so I can absorb non-heme iron? I'm like, yes.
Oh,
Ore Baba.
Like, that's yes. So cute.
Yes. But it's because these days people worry about the loss of volume in their cheeks and their wrinkles. For me, that's not aging. Aging is this, and it's putting in the work and testing once a year, seeing the evolution, look at maybe do a DEXA scan a year, check your bone density, muscle density, a saliva test a year. So not over-testing, but definitely allocating some budget to, the Eat, Burn, Sleep platform to keep you motivated to do your movement videos 5 times a week. And they only take 20 to 30 minutes, but it makes such a difference. day in and out. I just want to understand a little bit more about, the mouth and how things happen. What causes gum disease, recession, apart from age?
So for gum disease, it's multifactorial. The first is bacteria, so having high levels of bad bacteria in your mouth. The second is your response to that bacteria. And I think that's really important. People don't realize that. And that's where other conditions and other things play a role in. For example, you can have two patients, one who doesn't brush his teeth and smokes 40 cigarettes a day and doesn't really take very good care of himself. And then, you have another patient who brushes 3 times a day, flosses, fantastic, has never smoked in her life, eats a really great diet. But then unfortunately, when they both come in, the one who brushes super well has pretty bad gum disease, and the one who should kind of have gum disease and hasn't really been putting the work in, unfortunately, he's completely fine and he's chilling. And part of the reason for that is the body's host immune response and how that body's responding to that bacteria. So that woman who, yes, she's taking fantastic care of herself, she might have 1 or 2 bad bacteria which are heightened in her mouth, and her body is responding in a very aggressive and hyper-inflammatory way, and she's getting gum disease. And the other guy who has been blessed with maybe good genetics, not so much of a strong host immune response, he's got terrible bacteria in his mouth, but nothing's really happening for him. So it's not just the bacteria, but it's how your body's responding to that bacteria. And then also the genetic kind of predisposition to it as well. And then lastly is your habits. So smoking, eating badly, not brushing your teeth. It sounds maybe silly, and it's probably, everyone's been told by their dentist to floss and to brush their teeth better, but we genuinely mean it. And if you're not flossing, then you're not getting rid of 30% of the bacteria because it's all in between your teeth. So yeah, it's multifactorial. In terms of recession, sometimes it's caused by having had gum disease, which has then stabilized. And when the gum disease stabilizes and the inflammation goes, the gums shrink back and they kind of hug the tooth very tightly. And as a result, you can get recession. But honestly, it's good. It's better than having gum disease. The second is brushing too hard. Most people brush way too hard. So I always recommend that you get an electric toothbrush with a pressure sensor. You even brush in front of your hygienist or your dentist. Get them to show you how to brush. No one's actually been taught how to brush their teeth, ever. You get taught by your parents. And if your parents didn't have the best habits, then you're not going to have the best habits. And then the third is using very abrasive things. So maybe using like bicarbonate soda or baking soda in your toothpaste, or brushing. I mean, the stuff I've heard people use on their gums and their teeth is ridiculous. And then the last is orthodontic treatment. So once in a while, some patients will have orthodontic treatment, and when their teeth move, the gums don't move with the teeth. And as a result, the gums will stay down and they'll recede. And that can be worsened by if you have quite thin gums, or what we were talking about earlier about, patients who maybe have all sorts of colitis and their gums are very friable, then they're at a much higher risk of these problems happening.
I'm definitely guilty of brushing too hard and of always ending up not charging my electric toothbrush. I've got to get that habit back. It takes 21 days.
Mm-hmm.
It's 21 days to form a habit. And day 19 has been shown to be the day where people quit.
Really?
Yeah.
Huh. So far in.
So far in. So
Okay.
It takes 21 days to change habits, to rewire the brain. And it's been shown that the day where people are most likely to quit a new habit is day 19. At the beginning, like you, I was so surprised. I was like, how come so far in? But you know how the last few miles of a journey are the hardest?
Yeah.
I think there's got to be something like this, like a little self-sabotage where the brain kicks in and goes, no, I don't want to rewire this path, because habits are literally engraved in the brain. It's been shown that when we change a habit, it's like there is, the old one gets erased and the new one has been newly carved. And I think the brain doesn't want to do the carving and makes us rebel. So I shall try to brush with my electric toothbrush for 21 days, because I bought a very soft toothbrush, but still it's too hard.
I'm going to message you on day 19 with a little reminder to keep on going.
Thank you. This has been absolutely fascinating. And there's something else that I've heard, that people before going and doing chemotherapy were asked by their oncologist to go and sort out their mouth. Can you explain to us about this?
Yeah, so for chemotherapy specifically, patients will get quite a dry mouth, and saliva is your mouth's best friend. So if you don't have saliva, you don't have anything lubricating your mouth, washing away any, food, bacteria from in between the teeth. Your saliva neutralizes everything in your mouth. So if you have something very acidic, it gets it back to a healthy state so that you don't get decay and gum disease. So that's number one. And then also a lot of patients will get very nauseous during chemotherapy, and that also can really badly impact your teeth. The most important thing for patients who are maybe going through that journey is that often after chemotherapy, patients might be put on bisphosphonates. And this will really, the idea is that it stops any cancer from spreading through the bones. But what it also does is it impacts how your mouth or the rest of your body can heal if things are broken. So in the mouth, we see that if you have a terrible, horrible tooth and it needs to be taken out and the patient's been on bisphosphonates, then the risk of that patient getting a terrible infection or necrosis is very high. And so actually a lot of the time we cannot take the tooth out, or we have to take it out in a very, very different way. And often the bone doesn't heal very well afterwards, and these patients have to go through a lot of different therapies to help enrich that bone with oxygen and with the right blood supply. So what doctors want is to make sure that the mouth is in a completely prime and healthy state before these patients are going through these treatments. And then if, God forbid, there's a problem, hopefully the tooth doesn't need to be taken out. Basically, you'd never want to have a tooth taken out if you're on IV bisphosphonates, not oral bisphosphonates, particularly for cancer treatment. In case any of you are taking bisphosphonates for osteoporosis, that's okay. It's the IV ones for cancer patients.
So does it stop the immune system from doing its job effectively?
Yeah.
Is it like such a strong anti-inflammatory that it doesn't do the healthy kind of inflammation?
So what it does is, imagine if your bone's like a sponge, and then these IV bisphosphonates close up all of those little holes, and it stops blood supply from going to the correct areas. So then I take your tooth out, and in a normal patient, blood would come, you would get a really nice blood clot, there would be new bone forming, and that would heal in a couple of weeks. But in a patient who's on one of these IV bisphosphonates, the blood supply is blocked because of the bisphosphonates. So the blood cannot get to the area where it needs to heal. You don't get oxygen, so you don't get proper wound healing, and then you get necrosis instead. And so what that is where the bone dies. So you get bone death, the bone goes all weird and black and very spongy and very soft. And often patients will have to go through multiple treatments to irradiate or to oxygenate those areas.
Wow, that was fascinating. Thanks for explaining this. I've worked with many cancer patients, and it's been incredible to see the impact of nutrition on recovery, on side effects of chemotherapy, by supporting. Basically what we do is we do a diet that's extremely low in glucose, because cancer cells feed off glucose and CO2. So we work on breathing exercises, lowering stress, very low glucose diet. And also we support the liver to be able to process all the medical treatment. And I've had amazing results with people barely feeling any nausea, some people who didn't lose hair as well with chemotherapy. So there is a way of counteracting these effects. And what you're explaining about the mouth, I will be able to use in the future. So thank you so much.
Pleasure.
It's been such a pleasure talking to you. Really interesting. I hope our listeners have learned a thing or two. I definitely have. I will ensure to link your social media accounts, website, for people to come and visit you if they're in London. And if they're not in London, perhaps you can, advise them on what to do, where they are, and direct them towards the right places. Thank you so much, Victoria, for being with us today.
Thank you so much for having me. It's been a pleasure, so thank you.
Thank you so much to all of you for listening to this podcast today. I hope you enjoyed it. It's always such a pleasure to talk about health because it's not about the destination, it's about the journey. Looking after our health is a daily thing, just like brushing our teeth. We've got to focus on it, we've got to do it right so we can live better and happier lives. For those of you who are not members of the platform yet, we have a discount code for all our podcast listeners. You can get 15% off the memberships. Just enter the code podcast15 at checkout. Thank you, and make sure to read all the articles and all the free content we have on eatburnsleep.com to keep you motivated and informed and educated about living an anti-inflammatory lifestyle.